Good day everyone. We are Group 5 presenting 9 exercises from different muscle groups. Each exercise will discuss the involved muscles, its origin, insertion, and explanation of its movements. First, we will discuss 3 exercises from the muscles involving facial expression and mastication.
First movement for the facial muscles. We have the lip pucker and wide O. This movement is a dynamic stretch and contraction cycle for the mouth. Compress the lips and protrude them forward forcefully. Without opening the jaw wide, use the lip muscles to pull the corners of the mouth inward and forward to form a vertical oval, stretching the outer fibers. While the orbicularis oris remains engaged to maintain the O shape, the depressor anguli oris and levator labii superioris act as stabilizers to elongate the mouth vertically, while the horizontal width remains constricted. This involves the deep fibers pressing the lips together against the teeth and each other to create a seal. For the next movement, we have jaw clench and release. This exercise focuses on the conscious contraction and subsequent conscious relaxation of the primary chewing muscles. This is the upward movement of the lower jaw. The masseter and temporalis fibers shorten, pulling the mandible toward the zygomatic arch and temporal bone, bringing the teeth into contact. This is the downward movement of the lower jaw. During the release, the masseter and temporalis relax, while gravity and the infrahyoid or suprahyoid muscles pull the jaw down into a resting position.
And next, for the facial muscles, we have deglutition, or also known as swallowing. Now, to swallow is first, the process begins in the mouth where the lips seal tightly and the cheeks tense to create a pressurized chamber. The tongue then presses against the roof of the mouth, acting like a piston to shove the bolus toward the back of the throat. As the bolus enters the pharynx, the larynx lifts upward and forward to close the airway. Finally, the throat muscles contract in a rhythm-like wave, squeezing the bolus down into the esophagus while the nasal passageway is sealed off by the soft palate. During a swallow, your muscles work to manage the pressure and the direction of the bolus. In the lingual retraction phase, the styloglossus acts as the protagonist, undergoing a concentric contraction or shortening to pull the tongue base backward against the throat wall. Simultaneously, the orbicularis oris in the buccinator acts as synergist to maintain a watertight seal, preventing pressure leaks from the mouth. As the movement transitions to pharyngeal constriction, the pharyngeal constrictors acts as the protagonist to create a wave-like squeeze, driving the bolus downward. Throughout this entire movement, the suprahyoid muscles, like the mylohyoid, provide the lift for hyalopharyngeal elevation, which physically pulls the airway out of the way of the descending food. The lateral pterygoid acts as the antagonist by relaxing, allowing the masseter to maintain the jaw in a stable, closed position or occlusion, so the tongue has a firm base to push against.
So for the exercise of muscles of the pectoral girdle and the upper limbs, first, we tackle about the shoulder press. First, stand with your feet shoulder width apart. Hold the dumbbell in each hand at shoulder height with your palms facing forward and your elbows bent. Push the dumbbell straight up over your head until your arms are almost fully straight. Pause for a second, then lower the dumbbells back down to shoulder height. Here is how the muscles work during the movement. As you push the dumbbells up, your front and side shoulder muscles contract to raise your arms. With the triceps extending your elbows to help push the dumbbells up, your trapezius and serratus anterior muscles contract to stabilize your shoulder joint, preventing any lifting of your shoulder. As you lower the dumbbells down slowly, your deltoids contract to lower the dumbbells down slowly, preventing your arms from dropping too quickly. Your back muscles contract to help stabilize the movement, with your triceps and stabilizers muscles contracting to keep everything in place for your shoulder and arm joints.
Next exercise for the pectoral girdle is the dumbbell hammer curls. First, stand with a neutral spine and with your feet shoulder width apart, and a dumbbell in each hand or in one hand, while your palm is facing your torso. While keeping your shoulder blades retracted to stabilize the pectoral girdle, flex your elbow to lift the weight towards your shoulder. As you lift the dumbbell, your elbows flexes, which is driven by the muscle brachialis and biceps brachii acting as a protagonist to lift the weight, while the brachialis provides a support. As you lower the dumbbell, the muscles perform an eccentric contraction to lower the weight back to the transit starting point. Throughout this entire movement, the tricep brachii acts as an antagonist which allows the arm to bend and strengthen smoothly. To maintain the proper form, the anterior deltoids and trapezoids work to pin the humerus against the body and prevent any shrugging of your shoulders, and ensuring that the work remains concentrated on the arms. And the last exercise for the pectoral girdle is the dumbbell front raise. First, stand with your feet shoulder width apart and with your back straight to avoid unnecessary movements that can cause an injury. Hold the dumbbell in each hand with your palms facing upwards. Make sure to keep your shoulders straight with a slight bend in the elbow. Then slowly raise the weight until the arm is even level with your chest. Hold for a while, then lower the dumbbell back to the starting position. As you raise the dumbbell, the front deltoids contract to perform shoulder flexion, and that is done by lifting the arm forward and up in front of the body. This action uses a long lever arm, as the weight travels further from the body's center of gravity. The trapezoids and the serratus anterior contract simultaneously to provide stabilization whilst the arm is being lifted. This stabilizes the pectoral girdle, ensuring the shoulder joints remain secure and prevent unwanted lifting or shrugging of the shoulder blades. As you lower your arm, the deltoids contract eccentrically to perform shoulder extensions to lower the weight slowly, and the back muscles maintain tension to stabilize the joint and keep the arm aligned throughout the range of motion.
Lastly, we will tackle the muscles of the pelvic girdle and the lower limbs. For the first exercise, we will start with a side lunge, wherein we will start by standing with your feet shoulder width apart and your hands in front of you or on your hips. Then while keeping one foot planted on the ground, incline toward the opposite direction, bending your knee and lowering your body down into a lunge position. Your knee should be directly above your foot and your other leg should be straight. Hold this position for a few seconds, then push off your foot and return to the standing position with your feet being shoulder width apart. To explain the movements that happen during a side lunge, hip flexion and abduction, the main ascent, and hip extension and adduction, the return or descent, works together to manage what happens during a side lunge. In the main movement, the descent, the hip flexion and abduction are controlled by the quadriceps and the gluteus maximus acting eccentrically, lengthening under tension to lower your weight, while the gluteus medius stabilizes the hip as it moves away from the midline. As you transition to the return movement, the ascent, the gluteus maximus and quadriceps act as the protagonists to drive hip extension, pushing your body upward, while the adductor magnus provides that pull for the hip adduction to bring your center of mass back to the starting position. Throughout this entire movement, the hip flexors allow the glutes to fully extend the hip, while the hamstrings support the glutes in stabilizing the knee and hip joints.
This exercise is the standing lateral leg raise. Stand tall with your feet hip width apart and your hands on your hips or lightly touching a wall for balance. Keeping your core tight and your toes pointed forward, lift one leg out of the side away from your body while keeping the knee straight. Then slowly lower it back down to the starting position without letting your foot touch the floor between reps.
Now we will proceed to discuss the standard squat. We begin by standing with our feet at about shoulder width apart, the toes slightly pointed out, and with our chest up and core braced. We can either place our arms straight out forward or beside our hips. Now, we begin the movement by sitting our hips back and bending our knees, lowering the body as if sitting down into a chair. Descend until the thighs are at least parallel to the floor or up until manageable. Our knees should track in line with our toes. Hold this position for a moment, then drive through our feet to extend our knees and hips, returning to the starting upright position. For the explanation of the movement, during standard squat, the muscles work through a coordinated chain of eccentric and concentric contractions to control load and generate force. In the main movement, which is descending, the hips and knees undergo hip flexion and knee flexion. The gluteus maximus and quadriceps act eccentrically, lengthening under tension to control the lowering of the body against gravity. The hamstrings assist in stabilizing the hips and knee joints, while the gluteus medius works to stabilize the pelvis and prevent inward collapse of the knees. As for the ascent, wherein the movement returns, the gluteus maximus and quadriceps act as the protagonists, contracting concentrically to produce hip extension and knee extension, driving the body upward back to standing. The adductor magnus assists in hip extension and helps maintain proper lower limb alignment, while the calf muscles stabilize the ankle to maintain balance throughout the motion.
To wrap up our presentation, we have explored 9 essential exercises targeting various muscle groups, from the intricate movements of facial expression and mastication to the powerful actions of the pectoral and pelvic girdles. By understanding the origins, insertions, and the coordinated roles of protagonist, antagonist, and synergist muscles, we can better appreciate how our bodies achieve stability and generate force. We hope this demonstration has provided you with a clear understanding of human anatomy in motion. Thank you for watching!